Okay, welcome to our employee vaccination webinar. My name is Rick Lichardello from Human Resources. It's a great pleasure to be able to introduce our panelists this evening or this afternoon. Starting off, Dr. Marcia Russell.
Hi, I'm Dr. Marcia Russell. I'm an associate professor of surgery at UCLA and the vice chair for quality and safety in the department. And I'm a mom to 4 girls under 12 in the district.
Thank you, Dr. Russell. Dr. Jessica Kiss.
So I am a family medicine physician up at Palos Verdes Medical Group. Born and raised in PV, attended Rancho Vista and Peninsula myself. I have 3 currently at Dapplegreen. I'll have a 4th one coming up soon.
Thank you, Dr. Kiss. Dr. Clayton Kazan.
Good afternoon, everybody. My name is Clayton Kazan. I am an emergency physician. I am the medical director for the Los Angeles County Fire Department, and I'm an emergency physician at Little Company Mary Hospital in Torrance. I also grew up in the district. I'm a Peninsula High grad from '92, and I have 2 kids, one in 8th grade at Mira Lest and one in 11th grade at Penn.
Thank you, Dr. Kazan. Also representing our district is Ms. Brenna Taronis, Assistant Superintendent with us, and our COVID queen.
Well, actually, COVID compliance officer for the district. Thank you, Dr. Lichardello. I am actually behind the scenes with the testing and vaccine clinics and sites that you see right now, and also a lot of the questions that are being fielded right now are coming through my office with our team. So thank you for joining, everybody.
Thank you, Ms. Taronis. Our faculty is being represented by Dr. Tim Coleman, who is president of PVFA, our faculty association. Dr. Coleman.
That's right, PVFA president, and I also teach at Peninsula High School, so I'll look out for your children, Drs. Russell, Kiss, and Kazan.
There's no pressure there. And representing our classified labor partners, President Joan Lewis from CSEA.
Good afternoon. Yes, Joan Lewis. I am the secretary at Ridgecrest Intermediate School and a 25-year employee of the district, and did successfully have all 3 of my children go through our district, but they are well into their 40s.
Again, thank you everyone for giving us your time. We do have some questions submitted by our employees that I'll be throwing out to the panel. But just kind of started off, the district is going to hold a vaccine webinar next Wednesday, the 8th, here at the district office, where you can come and get a vaccination for free. They're using the Pfizer vaccine, and the hours are from 10 to 1, I believe, here at our district office. If you need any kind of directions or if you need more information, please visit our district website. On the website, you'll find a COVID-19 tab, and if you click on that, you'll have all the COVID information about the district that you'll need. So that being said, let's get started. Our first question, employees want to know about boosters, the booster shots. First off, who should get them and why, and do we have any data that supports the efficacy or how boosters work?
I'll jump in first.
Okay, Dr. Sam.
No problem. So the booster shots right now are recommended for people with impaired immune systems. And the reason for that is not that it's not a concern that the vaccine is becoming less effective. The concern is that people with hampered immune systems are not able to mount the full response to the vaccine in the first place. And so since they don't achieve the really high levels of immunity because either they're transplant patients or they're on immune suppressing medications, that they never reach a very high level, and so they fall faster. And so it is recommended for people with impaired immune systems to go get an additional dose as a booster to bump them up. There is some discussion already among the federal government about whether we're due for a 3rd dose for people with regular immune systems. Right now, the vaccines are performing very well at preventing severe disease and death. And there really is not any sign that the vaccines are becoming ineffective. So we're watching very carefully. I anticipate that boosters probably will be coming, but not yet for people with standard immune systems.
Thank you, Dr. Kazan. Dr. Russell?
I just wanted to echo, I agree with all of that. I anticipate there will be boosters recommended at some point, which is the case for most vaccines, which are a series. And so I think it shouldn't be a surprise, that a booster is going to be on the horizon. It doesn't mean that the vaccine doesn't work. It's just, I think, pretty standard for most vaccines in general.
And just to clarify, the boosters will be available at our clinic for those that are immunocompromised. So if that's not the case, or not the case for you, then please don't come and try to get a booster. We will have immunocompromised boosters available for those that need it. Moving on, just in general, we talk about vaccinated versus unvaccinated, any data on COVID-19 positive rates and data on hospitalizations in the area.
All right, I'll jump in. There was a publication in the MMWR, which is the Morbidity and Mortality Weekly Report from the CDC. It's a very well-respected publication. They actually published the LA County data from May 1st until I think it was July 25th, which is the period where the Delta virus has become the predominant strain that we're seeing. And they showed a dramatic decrease in hospitalization, severe COVID, and death in vaccinated people when compared to unvaccinated. So, and actually that mirrors data from San Francisco, San Diego, Oregon, North Carolina, Virginia, Texas, Florida, and pretty much every state that has put up their data for public scrutiny.
And hospitalization rates in the area, if that can be shared, just in general?
I don't have a rate, per X number of population. The rate of hospitalization is dramatically lower in people that are vaccinated. So what we see at the hospitals in the emergency departments in the area is the people that we're admitting with severe COVID almost universally are people who declined the vaccine.
So there is, in that same study that Dr. Kazan is talking about, they cited that unvaccinated have a 29-fold increased risk of hospitalization from COVID.
Rick, I'm just sharing my screen. I have a few of these figures pulled out from that study. This is what Dr. Kiss was mentioning, the unvaccinated having that much higher rate of hospitalization. And then the next slide, if I can advance it. I'm having trouble. There's a nice figure in that article that really shows the unvaccinated significantly separated as far as risk for death and hospitalization compared to the unvaccinated, which is what we're seeing, across the country.
And across our district, we're obviously advocating for the vaccination of our employees, and that's part and parcel to why we have our clinics available, as well as notifications that have gone out to employees that explain the process of why we want our employees vaccinated, and then if they're unable to be vaccinated, the testing opportunities that will come about for them, just to ensure their safety, their peer safety, and the safety of everybody on campus. Can somebody discuss the basics of messenger RNA vaccinations, and are they safe, and what are the side effects? Is what people see in the news accurate?
Sure, that's okay. I don't mind. So messenger RNA is a molecule produced in the cell nuclei in all the cells of your body. Your DNA is transcribed into RNA, messenger RNA. It goes out into the cell cytoplasm and it latches onto a ribosome, which is a little factory that then translates that into a protein. So the standard vaccines that we're all used to, many of them are where we actually have to manufacture a protein. We then inject the protein into your body and allow your body to react directly to the protein. And then we hope that that immune response lasts for a long time. The way messenger RNA vaccines work is we can actually specifically give the blueprint of how to make the protein we want to your cells, have your cells act as the manufacturing facility for the protein, produce the protein and present it to the immune system. So the advantages of an mRNA vaccine are you can make virtually any protein possible. You can do it very quickly, you can do it inexpensively, and you can make changes to it pretty easily. So for example, if it reaches the point where the strains have really escaped the current vaccine, we could alter the mRNA and make a new version of the vaccine very easily that would then cover those new strains. So all it really does is convert your cells into the factory instead of producing it outside and injecting that directly to your body. It does not interact with your DNA in any way. It does not go into your cell nuclei. The messenger RNA that's injected as part of the vaccine lasts for just a matter of hours in your body and is completely metabolized away. The proteins that your body produces and presents to your immune system to make antibodies also have a half-life measured in hours before they start to disappear. And then what we hope is that the immune response that you generate lasts for a longer period of time. And so far, several months in, we're showing that the immune response from the vaccines is very effective. This is very safe technology. It has a lot of potential future uses, both for vaccines, for cancer therapies, and other things. It is a remarkable advance in medical science. It is not new. It's been going on for more than 30 years, but this is the first time that we've been able to successfully mass produce an effective mRNA vaccine. There were a series of leaps that had to be made. The last leap was getting what's called the lipid nanoparticles, which are the little oily bubble that the messenger RNA is packaged into to allow it to get into your cells. That was the last piece of the puzzle successfully done in the last couple of years. And that is the part that's really the proprietary part for both Moderna and Pfizer.
Luckily, there's not going to be a test on this at any time, so I'm glad about that. All right, you bring up Moderna and Pfizer, which leads us to our next question. Are there any differences between 2-shot and 1-shot vaccination options? Is one better? Is one lend itself to boosters if necessary? Or
technology is different. It's completely different. So the JNJ vaccination is more of a historically similar vaccination to other vaccinations. It's using adenovirus, not active adenovirus, to carry essentially the protein into your body. So rather than making your body make it itself, it's already prefabbed in there, and then your body has to have the response to it at that point to build the immune response. So it's just different technology, and that technology, like I said, has been around for a really long time too.
anybody else want to jump in?
The Johnson & Johnson adenovirus, it's actually a monkey adenovirus, very similar to humans. I always joke that we're 98% chimpanzee. Some of us maybe 99. But the advantage of using a monkey adenovirus is that we don't have pre-existing antibodies to other adenoviruses that we've seen. So if you use a human one, you may bump into people that already have antibodies and the vaccine won't even get to your cell to do its thing. The adenoviral vaccines use a little piece of DNA that does go into your cell nucleus, but does not touch your DNA. None of these vaccines have the ability to change your DNA.
And I would just add to message that I would encourage everyone to get vaccinated with any of these vaccines. If you have a personal preference for one over the other, I think that's totally fine. I think it's just much more important to just get vaccinated in general, and you pick which one, 2-shot versus 1-shot.
I completely agree. And all 3 vaccines are looking at boosters. So even the Johnson & Johnson, the single dose, is already beginning to discuss what a booster indication might be for their vaccine too.
All right. Thank you for that. Dr. Gotanda, do you have any questions in the queue? That runs the extent of our questions that have been submitted or that were submitted prior to.
I did. I have two questions. The first one is for our doctors. So some of our employees were concerned about some of the symptoms or side effects from being vaccinated. So can you talk about the symptoms after people are vaccinated? And then there's also folks who are concerned about long-term side effects potentially.
Okay, so the side effects most commonly by far are flu-like illness, headache, low-grade temperatures, body aches, things like that. And it's more common in the 2-dose vaccines after dose 2 than dose 1. It usually comes on 12 to 24 hours after you receive the dose and lasts at most 48 to 72 hours. Most people it lasts less than 24. There are one of the more common questions, at least that I get from some of my other groups, is and in particular about kids, is myocarditis. Myocarditis is a concern for sure, and it's been present in the mRNA vaccines. It's been identified as a side effect. The risk of it is about, I believe, 7 per 100,000. So not a very high risk. And actually the key point, and this is true for pretty much every side effect, the risk of myocarditis from COVID-19 is 10-fold higher than the risk of myocarditis from the vaccine. And pretty much every side effect you look at that people talk about with the vaccine, the risk from the actual infection is orders of magnitude higher.
Thank you.
And Dr. Lichardello, so if I were an employee who were to get a vaccination at our September 8th clinic, and I have side effects, how do I get to miss work? How does that work?
I'm not supposed to be asked questions. This is the medical panel. I'm just here to yeah, so employees do have the COVID sick leave, the supplemental paid sick leave. That's been extended to them through the end of September. I don't know if that's going to be re-upped again as like the first one was with the supplemental paid sick leave. If you do have side effects from the vaccination, there are days that are allotted to you to cover those days. So you being out from vaccination won't count against your accrued leave. So that is available to employees.
Thank you. And for our staff members who are not yet vaccinated, what are their rights as an employee? So, I saw Governor Newsom said that all employees that work in schools have to be vaccinated or have to test. So if I choose to not get vaccinated as an employee, then what are my rights?
If you're unvaccinated, then you have to go through testing. We did put notice out to all employees with regards to what that process is like, and the district does offer testing 5 days a week at 3 different sites. The testing schedule is on our website with the days and times at each site. We want to make sure that, if there's a reason why you're not going to have the vaccination, that's fine. That's up to you. But in order to make everyone safe and everyone safe at our schools and across our district, we want to make sure that we provide testing for you to make sure that unfortunately, if you do come up positive, that we're able to catch it in enough time to stop the spread.
Dr. Lichardello, may I interject here for a moment?
Yes, please.
Can we just clarify for employees, because I know they're concerned about their privacy, that any of these notifications of being out on COVID leave or their vaccination card or their unvaccination status is to be done through their supervisor and principal, not through school secretaries. It is to be directly with their supervisor.
Yes, we've had discussions with all of our principals, made all of our principals aware of the fact that collecting that kind of documentation has to go to them. From them, it comes to human resources. This is not something that we want to involve. The fewer employees involved in this collection of that kind of data, the better. Do you have any?
And I actually have one thing to add. So with regards to the testing, just to let everybody know, we have been working closely with our school nurses. We have 5 of them. And right now they are almost fully trained in administering the tests, in addition to knowing how to use the software that we're using, which is Primary Health. All of it's confidential. When they enter it in, we only have a handful of folks that even have access to the administrator login to track anything. We are required, though, to report it to the state on a monthly basis. So I just want to make everybody aware of that. If you are using the district one, this does report up to the state if you're going through our program here. The nurses, the reason for training also is to provide on-site testing at some point once we do determine the number of individuals we will need to support, come mid-October.
Just to kind of piggyback and explain the process that what we put out notification to everyone, to employees, that said, following the mandates of the governor, OSHA, and CDPH, everyone's got to be vaccinated. If you're unvaccinated, you can't have a vaccination, then you've got to get tested at least once a week. From that, what we will do within the next 2 weeks is gather that information from employees, those that are vaccinated and their vaccination status, which means they're going to send an electronic copy of their vaccination card front and back to their principal. Those that are unvaccinated or don't share that information will be deemed unvaccinated by the district. And then by October 15th, what we will have in place is a system by which we will have those unvaccinated employees go through testing, and then we will collect the results just to make sure that we try to keep everybody safe. We have anything else, Dr. Gutanda?
No, before we conclude, can you just clarify? So if I participate in the vaccination clinic for the district, I'm getting Pfizer, and that means my first shot is on September 8th, and then I would get my second shot on?
You're looking at the first week in October, I believe, but Brenna, they're about three to 4 weeks out?
Yeah, they're scheduling it with you there when you leave. You're actually selecting your next date.
Fantastic. And then I become fully vaccinated after 2 weeks. Okay. Well, thank you.
After 2 weeks of the second shot, just to
Correct.
clarify. Yes.
Correct. Thank you.
And also, if you've only had one shot, then your status is still unvaccinated. There's not a partial. You're considered to be not vaccinated. That's correct, doctors? Yes?
Correct. It's 2 weeks after your last dose. If it's 2-dose regimen, 2 weeks after that, or 2 weeks after dose 1 of the Johnson & Johnson.
Okay. I don't think we have any more questions. No? Doctors, thank you very, very much for your time. We certainly appreciate it. Dr. Coleman, Joan Lewis, thank you. Thank you, Brenda. Thank you, Dr. Gutanda.
Thank you.
Thanks very much. We'll be able to blast this out to employees.
Yes.
Thank you
Put
all.
the magic on the website.
Yes.
Rick, can I ask one quick question?
Yes, sir.
If the vaccine boosters become recommended for those who are not immunocompromised, would the district then provide boosters for both? Because I know we're currently only giving the Pfizer, and maybe all three in the eventuality that the Johnson & Johnson develops a booster as well. Something to think about.
Absolutely. I'm going to defer. I don't know if Brenna has any other information.
I'll
about
take that. I'll take that up. It just happens that with the partner that we had, it was Pfizer. And those were the folks getting their first, now their second. They're able to do the first on that date as well as second. And then anybody that is immunocompromised is also eligible to come to our clinic. And we've shared it with their surrounding cities, just so in case anybody does want to use our particular clinic for that, it is available to anybody, staff, students, and the community.
Much appreciated.
Thank you, Tim.
Thank you, everyone. And those who are doing the student webinar, we will see you a little bit before 5 o'clock.
Time to go make a cup of coffee.
Thank you.
Have a good evening.
Thanks.
Bye-bye.